Lord, we come to you tonight and we just ask that you would be with each one of these council members as they are making decisions. Lord, we know that schools are closing down. We're hearing a lot of information from the CDC about the coronavirus, but Lord, you're not surprised. You've known about it. You knew it was coming. Lord, just help them to make the right decision. Help them to know what it is that they need to do to help our community stay safe and to keep as many people from being affected as possible. Lord, they're going to have to make difficult decisions and people won't be happy with them. But Lord, just help them to have peace in the fact that they are doing the best that they can. Lord, I just ask that you would wrap this community with your protective arms, that you would be with our seniors, that they would not be as affected, that you would be with our immunosuppressed members of the society, that they would know the right precautions and take the right precautions so that we can move through this as quickly and painlessly as possible. Lord, we just ask that you would be with each person that sits here that has something to discuss tonight. Lord, they have a matter on their heart. Give them the right words and give these council members your wisdom. We praise you for what we know you will do to bring us through. In Jesus' name, amen.
Amen. Thank you for that. I'd like to open the meeting with a pledge. Christine, would you like to lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to change the order of the meeting just a little bit. We have special presentations tonight that are very important, and I want to make sure there's ample time for that. And for those of you that are here for that, I'm sure you'll appreciate not being here much longer beyond that. So with that, the city has been working, developing, and reworking various plans for the community. This is a very fluid situation, so there's adjustments that are being made almost on a daily basis. We are, most importantly, doing two other things. We are coordinating our efforts with other agencies and entities, ranging from the county officials to the hospital officials. And probably the last thing I would like to say is we're relying on subject matter experts to guide us in the right way, both medically, legally, and from public safety perspectives. So we're going to hear from several of the experts today, starting with PHELPS Health, followed by the County Health Department, followed by Emergency Services, and then I'll defer to the two chiefs of ours in case they want to add something above that. So with that, Dr. Ratchford, would you like to lead us off?
Okay if I run this? All right, well, thank you, ladies and gentlemen. I was invited here tonight to come speak on coronavirus. These slides are slightly out of date. We're going to change this a little bit, but I think I can do this on the fly. So my name's Dr. Nathan Ratchford. Don't hold it against me, but I'm actually an OBGYN. I'm not a virologist. I'm not an infectious disease specialist, but I work with a lot of smart doctors and nurses at the hospital, so I've got good backup here. So I'm actually the Chief Medical Officer of the hospital at PHELPS Health. Carrie Haven, she is the Chief Nursing Officer, and she was planning on presenting with me. And I'm going to cover her information, but as you can imagine, it's been a busy day at the hospital, and she had to stay behind to take care of some things. So I'd like to start with a background of this disease, just for educational purposes, if nothing else. So you've probably heard this called coronavirus. COVID-19 is the abbreviation for it. In the scientific literature, they call it SARS-CoV-2. These are all the same things. So COVID-19 it's a new disease. It's novel. First identified in China, December 2019. There's been a growing number of cases. Like I said, these slides made these last week. I don't know if you pay attention to numbers reported by the CDC and things like that, but these numbers have been growing and new countries have been added on a daily basis, including the United States. Here locally, Missouri's first case was confirmed last week on the 7th in St. Louis County. Currently, we have 5 confirmed cases in the state of Missouri. At Phelps Health, we actually started working on this when we first heard about it in late December. We've got many people that are working on this, multidisciplinary from various parts of the organization. It's a complicated problem. It takes a lot of people to tackle this, and we've been, I would say, pretty aggressive at working on this. We're a big organization. We employ over 1,800 individuals. We have a lot of policies that deal with occupational health, treatment of patients. There's a lot of things that we have to consider with this. We've also been working with both local and state public health officials, and as best we can, we've been following CDC guidelines for the best way to manage this disease and pandemic. So I think it's important that people understand the symptoms of coronavirus. So COVID-19 is actually a type of coronavirus. Coronaviruses are very common. Coronavirus is one of the causes of common cold. Actually, it's a different type of coronavirus, but your symptoms can be quite mild, like a cold. They can be quite severe, like influenza or worse. Based on current understanding, there's a lot of variation in both the symptoms and the timing. 2 to 14 days after exposure, as you can see on these slides, fever, cough, shortness of breath. People just feel crummy when they have this. So it's important that we talk about reducing our risk of infection. If anybody's been paying attention to the news and you've heard about social distancing and things like that, these are important measures that we can take as big groups of people, but for you, the individual, I can't emphasize this enough, washing your hands. This is the most important thing that you can do. You want to avoid close contact to people that are sick. Staying home if you're sick. Don't go out and expose other people. Covering your cough and sneezes appropriately. You don't want to use your hands. Wearing a face mask if you are sick. Current recommendation is if you are not ill yourself, if you haven't been exposed to somebody, wearing a mask is not going to help you. And then it's really important that you clean and disinfect appropriately. So I think it's important that people in our communities know what to do if they're sick. So I can't stress this enough. It's important that you call your provider first. I think in our society, we've become accustomed to that when you are sick, you go to the doctor, you go to the emergency room. These are natural things that we've learned to do. And it would really help us out as healthcare providers if you're concerned, if this is something that you've got on your mind, call your doctor's office first. We've got walk-in clinics at the hospital, call them first. And then they're gonna ask you questions. CDC has guidelines on how to screen patients. It's called a medical screening exam. And based on that information, they're gonna give you instructions. That could range. It might be something that they need you to come in and get testing for. It might be something that they feel that you're okay to stay at home, rest, push fluids, monitor your symptoms. And you want to limit your contact with other people so they don't get sick. We always put this in here for things like this, but if you think it's a life-threatening emergency, definitely go to the ER, call 911. So on the 11th last week, the Department of Health and Senior Services, they have a statewide public hotline. The number is there, 877-435-8411. That's both for citizens of the state of Missouri that think they might be sick. It's also for providers that are taking care of patients that think they might have concerns that they need to get tested. And this is 24/7. So things that we're looking at next, we're going to continue to monitor the situation as it develops. We have internal mechanisms within our hospital to disseminate the most up-to-date information. We've got lots of people that are watching this. it's important that people know what the signs and symptoms of this and what to do if they're symptomatic. So like I said, if you feel like you're sick, you need to call your provider. It's really important that people follow those personal protective measures. It's important that they're washing their hands, they're avoiding sick contacts. If you think about how many times you touch your face every day, it's a lot. You want to avoid these kind of things. These are what lead to you getting sick yourself. And then it's important for families to plan ahead on what they're going to do if they are affected by this. What are they going to do for work? What are they going to do for daily needs, food, childcare, things like that. And then it's really important that if you're at an increased risk, that you stay home, you avoid gatherings. So you see these things out by the CDC about like different age groups and things like that. If you're immunocompromised, these are the people that if this were to spread and affect our community, that they would be the most affected. So I'm open for questions.
Any questions for Dr. Rashford?
For those individuals that have succumbed to the most severe symptoms, is there any time frame? Like, I mean, is it exponentially more quickly than if someone stays at home and gets, heals on their own?
So when you
Like the severity of their symptoms progressing.
You're asking about people that die of this,
Yeah.
correct? So the people that get sick to the point where they die, they typically have some sort of underlying respiratory problem already. They're probably not going to tolerate this very long on their own at home.
Mm-hmm.
When I say people that can, ride this out at home, it's typically healthy adults that don't have other medical problems. They're the ones that are going to be safest to be monitored at home.
Mm-hmm.
Doctor, I read talking about children has been noticeably absent in this discussion. There's more of a focus on seniors. Can you talk a little bit about children, how they're affected, not affected, and saying children broadly, is your answer different, let's say, for somebody that's 1 year old or an infant versus somebody that's a toddler?
That's the distinction I was going to make. So yes, children are affected more, but it's more the newborns. It's the children that haven't built up their immune systems very well. They haven't got their series of vaccinations. The older kids, they're going to have symptoms and a disease course very similar to what an adult would.
Okay, thank you. Matthew?
Doctor, I hear a lot of people say, like, I don't know what the big deal is. This is no worse than, our average flu season, and more people die of flu every year. So why are we taking such drastic steps to address this, and are we overreacting?
So true. For most people, this will not be that severe. For most healthy adults that make up most of the population, like I said earlier, this will be like a bad cold or the influenza, which fortunately most people get over with on their own with just supportive care. But you talk about communities, you talk about the population overall. The fewer of those people that get sick quickly, that will protect the immunocompromised, the babies, the older people that have other health conditions that are going to be more serious. That's the real concern. So when you're doing things to flatten the curve, you're getting people out of these community events, you're stopping big groups from meeting. The likelihood is that eventually all the people that were going to get sick anyways are still going to get sick, but at a much slower rate. So the people that do need more aggressive interventions, admission to the hospital, the ICU, et cetera, the healthcare system will have capacity to take care of those people.
So what you're saying is that our healthcare system is not equipped to handle everybody getting sick with this virus who need the help, and that we need to, it's not the seriousness of it necessarily, but the amount of people that are going to get sick and our ability to treat those people who need treatment.
True. It's not so much the severity of illness that's scary. It's how quickly could this spread and how many people get really sick really quickly. It could outpace what our ability to take care of this.
So a different question. So because of the social distancing that's been recommended and that's where kind of a lot of the local organizations like S&T are implementing pretty heavily here. How long does the social distancing sort of need to last to be effective, I guess, at the community level? I mean, if it's 14 days potentially to getting symptoms versus, I guess, whatever, and that's like the incubation period, like.
Right, so 14 days is based on our best understanding
Yeah.
of how the virus behaves based on the experience in China.
Mhm.
So, if we as a country had the ability to like force everybody to stay home for 2 weeks,
Yeah.
this would go away overnight. But we've got hospitals that have to stay open and police departments,
Mhm.
whatever. So there's still going to be people out there
Mhm.
working with other people. The infection will still continue to spread,
Okay.
but at a much slower rate because of that 14 days comes from that, like you said, incubation period.
Okay.
So, but I think it's worth mentioning that if it's not abundantly clear, this is an evolving, almost daily changing process as we get to understand it better. I think 14 days is a reasonable time frame currently. That may change, so we just have to stay on top of it.
Okay. Thank you.
So if a person gets infected with this virus and gets sick and recovers, do they then have an immunity to it, or can they get reinfected?
Yes, this is a one-off kind of thing, but I heard somebody say that they had read somewhere that somebody in China had got reinfected. I don't know the specifics of that, but the way these things typically work is this current virus that's going around right now. Yes, if you were exposed, you got sick, you recovered successfully from it, then you would be immune to it.
But they could mutate.
That's why it comes back every year. But we're not that far into this.
The likelihood of this coronavirus mutating to another form of corona is very potential too.
Yeah, it will happen. Yeah.
Mm-hmm.
Doctor, I know a lot of people, there's been a lot of talk in the news and locally of people hoarding toilet paper. That's not necessarily a symptom. I think, is there a reason that people need to be hoarding toilet paper or chicken noodle soup or something to that effect from a medical standpoint?
I do not believe hoarding chicken noodle soup and toilet paper is going to make much of a difference with this disease, no.
I mean, is diarrhea a common
He's not
concern?
is he?
Diarrhea is one of the symptoms associated with it, but it's really low down on the frequency. So the cough, the fever, the respiratory things.
So
those are what people are going to have.
Are there suggestions from the medical community of things that people should consider maybe buying extra of or taking consideration of in light of this illness?
I'm not aware of any guidance or direction on that question specifically for the medical community, but I would say common sense tells you. I mean, you need to have the ability to wash your hands or alcohol sanitize, those kind of things. Not that I'm encouraging people to hoard those by any means, but I think having those available, that's going to be the most bang for your buck if you're looking for something to help yourself through this.
And do you need antibacterial soap, or can, Zest or just some regular bar soap work?
Again, speaking as an OBGYN, my understanding of antibacterial soap and like the pediatrician community, for example, is it's a little bit divided on if it's appropriate or not. I'm not aware of an antibacterial soap being preferable to just a regular hand soap. But, having the ability to wash your hands, that's the key.
Right. Thank you.
I heard you say that there's a 14-day incubation period, and I've heard that number thrown around. What's the typical time for recovery for a healthy adult?
What my understanding is once somebody actually gets sick, the worst of their symptoms will be over like 2 to 3 days. We all recover from viral illnesses differently. I don't know how long it will be before somebody felt normal, but the actual illness phase would be over 2 to 3 days.
I think that speaks partly to Mr. Krau's question of whether or not somebody's going to have a month's worth of toilet paper saved up because they're going to get sick. I just wanted to clarify.
I would agree with you.
There's no other questions for Dr. Is Ed here? Ed, do you want to add anything?
The only thing I would add is that at Phelps Health, we've spent a lot of time in the last 24 to 36 hours starting to look at our processes and making more significant changes to our behaviors. One of the things that you'll see come out very shortly on our social media is changes to our visitors policy, and that is, of course, to protect our patients, our staff, and those visitors that come into our organization. Internally, we are going through the same process of the social distancing, eliminating meetings. In fact, tomorrow morning we lock our meeting rooms to eliminate meetings within the organization. We're working hard to make sure that going forward we're meeting either through virtual means, old-fashioned telephone calls, those kind of things, to help limit contact and limit the rapid spread of the disease. And like Dr. Ratchford said, this is a fluid situation, and the rules today are different than the rules yesterday. More than likely, the rules tomorrow will be a little bit different too. So we're working hard to make sure the health system is up to date and ready for the best we can, ready for what's to come.
And then just this is a last question for Dr. Ratchford, which you should be in a really great position to answer. For women in the community who are currently pregnant, is there anything that they need to be doing or be more cautious of specifically, or if they're just making sure to wash their hands, engaging in social distancing, like they
So-
don't need to worry that there won't be beds if they need to deliver their baby or?
Oh, sure. Yeah. So the vital functions of the hospital that you're talking about, the non-elective kind of things, they have been untouched so far.
Okay.
So for deliveries and things like that, yes.
So have you changed your procedures for elective things happening in the hospital at this point?
Yes, we're evaluating for which elective procedures we do in the surgery suites are high utilizers of disposable equipment like gowns, masks, drapes, things like that. And I've been working with the surgeons and their leadership on how we can kind of push out and phase some of those surgeries to help match our demand to what our supplies are, which are limited.
At the present time, what are the visitor protocols?
Well, let me bring up the page here, and I'll read it off to you. And I'm not a Facebook expert, so you're gonna have to forgive my speed.
Better than I am.
So I'll just read this. To protect the health and safety of patients, staff, and visitors, and to prevent unnecessary contact with people who may have been exposed to the coronavirus disease, Phelps Health has placed visitor restrictions at all its facilities. Until further notice, the following visitor restrictions will apply at Phelps Health. No visitors will be allowed in the behavioral health unit, transitional care unit, and acute rehab unit at Phelps Health Hospital. Visitors of obstetrics, pediatrics, and nursery patients at Phelps Health Hospital are restricted to parents only and one support person who is older than age 18. Got some more here. I'm working the technology. Only one designated family member will be allowed per patient for all surgeries. In all other Phelps Health patient care areas, including the hospital and all clinics, only one designated family member will be allowed per patient. Again, the idea is for us, we have a very susceptible population within our organization. We need to limit the best we can the potential exposure associated with people coming into our facilities. In addition to these limitations, for the people that are allowed in, they'll have to go through a screening process as well. We're in the process of developing how that's going to work. We should have that ready in the next 24 to 36 hours. And so again, aggressive limitations on unnecessary contact with people in our organization.
Okay, great.
Can I have a follow-up there? So if there's one designated family person, what if somebody in the community doesn't have a family member that's available? Can they have a non-family support person come with them for a surgery, say?
It's one designated support person.
Okay.
So, yeah.
We're very fortunate to have your facility in town and the professionals that we do. So thank you very much for coming, both of you. I'm going to leave some time after these presentations and take a few questions from the citizens. So just hold that. So,
Thank you.
as I mentioned, a lot of cooperation. This is a team event. So Commissioner Stratman, would you like to say a few words and introduce your professionals?
I would thank you, Mayor, for allowing me to be here tonight. My name is Larry Stratman, Phelps County Commissioner, and I'm here basically for one reason, is to introduce two county employees who are kind of at the forefront of this situation that we have here. I do want to let, and I guess one of the reasons I've come here is to let you know that these two people enjoy the full faith and confidence of the Phelps County Commission. So from that standpoint, I want you to understand that when they speak to this, they will speak for us. The first is Ashley Wan, who is the head of the Phelps Mary's Health Department. Ashley is our liaison to the State Health Department. So she enjoys a lot of flexibility and a lot of authority. So she's here to inform you as to what her authority actually is and her suggestions. The other is Mike Kern. Mike Kern is the Emergency Management Director for Phelps County, and he's more the resources person. So he's the guy gathering the resources in case it gets bad enough or the worst case scenario hits. So basically, we're here to inform and instruct the people of Rolla and Phelps County on what they can expect and what they'd expect from us, and maybe what they will expect from the City Council. So with that, I will introduce to you Ashley Wan, head of the Phelps Mary's Health Department.
Thank you. Ashley, I know you're soft-spoken and you're
I will speak up.
probably be dry from all the talking, but
This is my 6th meeting today.
I can
So
imagine.
yes.
I can imagine.
Thank you, Mr. Stratman. First, I want to say that this is a collaborative effort. I am not in this alone. Every agency within the community has come together. Phelps has been amazing to work with. They have my utmost respect because they are going to hit this virus head on. It's going to present head on. And when I say that, I do mean it will present. This is not an if, hypothetical, what are we going to do? This virus will hit us. So I think it's very wise to take Mr. Ratchford's, or Dr. Ratchford's warning to be prepared, things that you can be prepared. In saying that, that has also been a lot of frustration from a public's viewpoint with this, is because our message continues to be prepared. Be as prepared as you can be, prevent where you can prevent. We're doing the best we can with the unknown. So the basics of any illness is, hand washing, good cough etiquette, all the things that Dr. Ratchford laid out. That is what we need to do right now. The CDC guidance, Department of Health and Senior Services guidance, it's ever changing. That is also another frustration. What I may recommend today, and when I talk with, daycare facilities and long-term care facilities, and then I have to turn right around and tell them something different. It's ever changing. We are learning. The latest CDC recommendation, which is one reason that I am here, is limiting social gatherings. You see, the recommendation came out over the weekend to limit social gatherings for 8 weeks of any individual or group, spontaneous or planned, that involve 50 people or more. Adding to that, also if any individuals, 10 individuals or more that fall into that high-risk category. So you're elderly, you're immunocompromised. It is a recommendation. It is a strong recommendation from the CDC. It is not a mandate. So there's that, but that is the recommendation, and I would stand behind that recommendation. As for schools, the recommendation from the CDC, the Department of Health, and myself is to remain open. That is what I've encouraged. That's what we've pushed out. They are not included in the social gathering. They are an exemption from that. Schools are safe places. you have the same students in the same communities attending together. We have no community spread. They are safe. The same is going with daycares. We are encouraging them to stay open. They can go above and beyond. They can make the decisions on their own, which some public school systems have decided to do. They have decided to close and extend spring break, and I will support them in that decision as well. Businesses, we are starting to field a lot of business calls. You know, how should we stay open? Should we not stay open? Should we modify? And it's an individual case-by-case basis right now, unless we follow that limiting gatherings.
Okay. Any questions from council to Ashley?
Mayor, I have a
Yes,
question.
ma'am.
When you say limiting meetings to 50 people, and correct me if I'm wrong, you say that applies to businesses or does not?
It does not apply to normal day-to-day businesses.
So for example, Walmart or Menards,
Correct.
you wouldn't expect a big place like that to limit to 50. Is there a limitation that they're to recognize?
At their corporate level, they have taken the stance to modify hours, and some of them are doing that to allow for restocking and for proper sanitation.
But your recommendation is just 50, no more than 50 people at a civic or social event?
Correct. Yes.
Rachel?
So I just wanted to kind of follow up, because if the CDC's recommendation is sort of to limit those social gatherings for 8 weeks, is that just based on the fact that we're not going to, as Dr. Ratchford said, we're not going to close down everything. So, you know, it's better to limit it over a longer period of time to kind of flatten the curve.
Correct.
Okay.
And I do believe that is it.
Okay. Thank you.
This gentleman has a question, and I know what it's about. So did you get a sufficient answer, or do you want to ask it now?
Actually, it was a question, I wanted to make a statement at the end. I had a question for the doctor, because as you imagine, everyone's very up on the situation, but my understanding is most children will be asymptomatic. Is that correct?
I haven't heard that, but I have seen where I don't think children are at any more risk than healthy adults. But
Yeah.
older children, not like newborns.
Right.
And that is exactly what
Okay,
I'm
thank you.
hearing too.
Look, with the internet today, there's as much incorrect information as correct information. So one of the things that we ought to think about is, where does the citizen go to get proper information? I'm going to talk about locally. I know they can go to CDC and things like that, but locally, how are we coordinating what is on the hospital's Facebook versus your Facebook versus our Facebook and websites and so on and so forth? Have we talked about that?
All we said is we'll push with the health department and the hospital issue, so.
Yes, okay. I'm not sure on the city point, but I have specifically talked with the hospital media, PR department, and we're kind of running things through each other. You know, here's what we're looking at, here's what we're thinking, well, now here's what I'm looking at, here's what I'm thinking, making sure our message is consistent. When they share something, I share something. When I share something, they share something, just so the same message, so the community sees that we are collaborating together.
All right, so we're going to defer to you then, and then anything that we're putting out there is consistent with that. Okay. Matthew?
Ashley, do you recommend that the city take any action other than to follow the CDC recommendation, or should we go further than that and actually take steps to limit meetings?
At this point, I would recommend that you strongly follow the CDC recommendations. I do know that the president did speak and made some statements that were much more stringent than that. But right now, the stance as public health would be to follow the CDC recommendations.
It's a fluid situation, so I
Yes.
think I'm just a little cautious saying, yeah, that might be the answer right here at 7 o'clock at night, but tomorrow, the next day, it could be different. So I think the community just needs to know that.
Yes, it is a very fluid. I mean, what we're talking about right now, we could walk out and it can be completely
Mayor, maybe you or Lance or John can elaborate on who has the authority to limit meetings.
Okay. We have a rough idea with that. There are statutes. I'll defer to Lance, but Lance is doing a more thorough analysis. Council has authority to do certain things, and believe it or not, it actually does extend beyond the city limits. The mayor, as I understand it, has the ability to declare a civil emergency and what that means, and the health department has the authority to do a certain number of things as well. So, without putting you on the spot, when is all that going to be vetted out?
I expect to have it in just the next couple of days. I've spent the majority of this day going through and looking at what cities can do in response to emergencies such as this one. I do know that under Chapter 77, the City Council has the ability to do quarantines. I believe the County Health Department can also do quarantines. But as far as who has what authorities, there is no ultimate answer as to who has higher authority than each other than perhaps the governor of the state of Missouri.
Well, obviously, we're not in a position right now where we need to quarantine anybody, thankfully, and hopefully we never get there. But if, let's say, that does happen, do we have to give public notice and have a hearing and then first and second reading?
No, and then the response, again, using, this information is spread out over multitude of chapters. So if there is an emergency situation, you have the ability to call a meeting without giving 24 hours notice. And you can even go into closed session, but you have to, the minutes have to reflect what the nature of that emergency is. Once you are in a meeting, you have the authority to do anything necessary for up to including quarantine. So there is broad powers for a third-class city to invoke if there's a need to.
And hopefully there is never a need to do that.
But we could be facing the size of groups and
Sure.
things like that. So there's three levels of authority. We're just not sure, or at least I'm not sure, how they overlap and conflict.
And I suspect that the answer is going to be that there is significant overlap, and the explanation that I heard just a few minutes ago, which I think is probably correct, is best course of action is for everybody to get together
Yes.
and make a joint decision, if
I
at all
agree.
possible.
I agree.
Ashley, thank you very much. I'm going to hold out questions towards the end here. So let's get through the main presentation and then take two or three from the general citizens. Mike?
I'd like to thank you for letting us be here today. Want the citizens to know that, the department heads, the city, the county, the health department and all the health agencies within the county are all working together to minimize the impact to our city and our community. The citizens need to remain calm. This is not the time to panic. We are on top of things. We are looking into every possible aspect of what may happen. If people would go to the store and just buy a week's worth of groceries or 2 weeks and stop buying everything that they see, we would have enough for everybody. The stores are not going to run out. They're going to restock every night. The stuff will be there in the morning. We just don't have to have the level of panic that we have. Just like the doctor said, the majority of people, this is going to be flu-like symptoms. It's not going to impact the majority of the citizens the way that they're fearing that it's going to. So people just need to remain calm. When it's time for us to respond as a community, then we'll respond as a group and make sure that we're doing the best that we can do for the citizens of the county and the city. At the sheriff's department, we've taken extra steps to ensure that, our jail remains free from infection. We're going to limit the number of people that are coming into the department. We're going to vet the people that are coming into the jail so that we are able to prove to know that they're not infected and they're not ill. And if we have them, we will isolate them. We're doing the exact same thing that all of the public needs to be doing. We're taking precautions and we're making sure that the hygiene is up to where it needs to be and that we're sanitizing everything that anybody touches. So, and hopefully we can get through this pretty quick without much effect. So,
Thank
That's
you.
all I have to say.
You know, I've heard John Butts say many, many times over the years that I'm here that the level of cooperation between the city and the county departments and offices is phenomenal. And, you know, there's a lot of places around the state that don't have that kind of relationship.
It
So
is absolutely amazing what we
it's
have.
really important that that occurs. So, thank you.
Thank you.
Chiefs Fagan, Smith, and Lieutenant Woods. Would you like to add anything?
Up for just a minute. We'll get Brad up here and just introduce Brad so everyone's aware. This is Brad Woods. He is the Emergency Management Director for the City of Rolla. He's been planning and meeting regionally during this crisis for the last month with regional directors through SEMA. He's our direct contact for the City of Rolla to SEMA through the mayor's office as well. He's appointed by the mayor, and he's being very proactive in being prepared, making connections, and just outlining where we need to be today and how to prepare for the future. We can what if this in many thousands of different ways, but there is no reasonable expectation that we would have a good answer by what ifs. We know some very good things today to be prepared for. So emergency preparedness is preparing, responding, and then recovery. So thanks be to God, we'll all recover. We will recover. And so that's the message for us to be thinking of. We're making plans to respond. We have the equipment we need. Chief Fagan has the equipment that he needs to respond to an emergency in Rolla. So if we have a situation that requires us to respond to someone with flu-like symptoms, we're prepared to do that, and we're prepared to do that without quarantining any of our people, limiting that exposure. So we're making those plans. Again, you can what if that, but we have a positive move forward. Want to see something? Chief.
I just wanted to state that most of the day today, I met with my staff and with all my supervisors. It's going to be business as usual for the police department. We may do a few things different just for our own protection, but if you call the police, we're going to come. Our officers are going to be out on the street. They're going to be very visible. So I don't want people to worry. We may have people come and if you have a minor police report that doesn't really involve anything to where we have to do any evidence or something, we may take that report over the telephone. Little things like that we're trying to do just to reduce our contact with the public, but we know that as a police department, we are going to be out there and have contact with the city. So I just want all of our citizens to know that we're still here. We're not reducing our staff. We're not doing anything different. We even have a mutual agreement with other police departments in Phelps County. Should, God forbid, some of our people get quarantined due to exposure, we have understanding from other departments that they'd help us out, and if it should happen to their department, we're going to help them out. I mean, law enforcement in Phelps County is unlike any law enforcement I've seen in my entire career, just on how well we all work together. So protection's going to happen, regardless of what happens.
Let me reiterate that point about team unity. The people in this room that are providing public safety and commissioners and such are talking every day. We're talking through the process, asking questions and verifying. Missouri S&T as well. So we're covering that very easy. And there's no one in this room that's on opposite sides. We're on the same team. That's us and our citizens taking care of everyone the best we can. There's no big eyes. We're all about protecting everyone equally.
Thank you, gentlemen. John, with all this horsepower around you, you're in an envious position.
Yeah, I mean, they do make they make it about as manageable as you can, and we've said that for years. The cooperation in Phelps County, the department directors, the city employees, we're going to continue to provide the services that we need to provide, and certainly use the city council as you're hearing things. You got concerns, let us know, and we'll try and get that run through the group and get answers out there. So I think we're as prepared as we can be.
Okay, great. This is when people shine and all the training and resources that have been put in place. In the essence of time, how about up to 3 questions from the citizens? And I ask if you would come up here, because if you have a question, chances are somebody else would have the same question. So if you want to come up, I'll take 3 questions now.
I'm just curious, the microphone's right here. I'm just curious about how do we determine who's going to be tested? We see people with symptoms, and I know that the hospital can run the test, but I'm sure, can doctors run the test as well? And who do we determine who's going to be tested and what's the criteria for that?
Does this have capability to search? Does this have capability to internet search? Can I go to the internet to pull up the CDC guidelines? I do apologize. Let's see if we can find it on this website. To be tested through the Missouri State Public Health Lab, there are criteria that have to be met. And that is why physicians, when they're wanting to test, they have to call the state for guidance first. There are requirements that have to be met for that. They're given a yes or no. A no does not mean they cannot be tested.
Hey, Ashley, if you can, speak to the microphone that's in front of you, yeah, because there are people watching.
Okay. Public or private labs are testing as well. So just because they do not meet criteria to be tested through the Missouri State Public Health Lab does not mean that they're not tested. They can opt to go through LabCorp or they can go through Quest. It is strongly encouraged right now that all testing be done through hospital facilities. And that is how we have worked it so far in our county. Correct. There is guidance that's slowly coming down, trying to make it to where it can be tested in private physicians' offices. We have not had to go that route yet. We are not at the capacity of testing that we've had to go there. I think the hospital and, with public health, we would look at alternate routes before we would try to encourage that. Does that answer your question?
Any more citizen questions?
The best I can right now. It's the best I can right now.
I'm Pastor Dan Phillips from Central Community Church of God, and I represent a few churches here in town who have daycares. And the concern that was expressed to us, and the reason several of us came tonight, was somehow it was communicated or miscommunicated that the city would be making a decision about keeping daycare centers open during this time. Obviously, none of us want to put any child at risk. That is absolutely unconscionable. We'd never consider that. Something that is important for us to remember is when we remove child care centers from the daily lives of folks before we even have the coronavirus in our neighborhoods, is there are economic issues there for people who have children who won't be able to go to work because there is no child care for their child. Additionally, churches are exempt from paying unemployment tax, and according to what Mike Parsons and others have said, and even I don't know about how those things are going to work out, but they would not be eligible for unemployment. So that's another thing. These people are paycheck to paycheck people, I think, like many of us are, but they are certainly dependent upon those incomes. I wish that we had a larger margin. I wish every church had a larger margin, but over the last many years, giving has gone down in churches, and so we are probably not going to be able to float those folks any additional income if our centers are closed. And just one last statement is, if we do close our daycare centers, the people who will most likely be asked to watch the children will be senior citizens, who are the ones who are most likely to have negative effects from the virus. And so I'm not by any means asking that we would put anyone at risk, but these are real issues. When I listened to the president yesterday, went to bed last night and couldn't sleep for several hours trying to figure out what's going to happen. And anyway, just appreciate you folks. I know you have to make hard decisions. I know on the behalf of the community, the faith community here, we will abide by whatever decisions you folks make. Thank you.
They are tough decisions, and, you know, the course of the virus will determine, you know, what each course of action is. But any other questions from the citizens before I go back to council? Council persons, any questions for any of our professionals? Yeah?
No. Council? Oh.
Yeah.
Okay. Yeah, I'm sorry. With the regular, you know, day-to-day flu, year-to-year flu that we deal with, influenza, what symptoms might tip someone off that they need to get tested in the first place for coronavirus? I mean, if you're having fever, shortness of, you know, a cough or sneeze, you know, sometimes 2 or 3 days taking off from work is enough to help relieve that. Should you, and then also, with that in mind, you know, just some kind of guidance on how many days, I mean, if it's a young person, young adult, you know, staying home from work for a few days with those kinds of symptoms, you wouldn't automatically have to assume that it was corona. But would that warrant all these people to come in and get tested?
So keep in mind what I'm about to say is we do not currently believe we have community transmission.
Right.
If this was more prevalent, this messaging would be different. But so you're right. If someone has fever, cough, symptoms consistent with the flu or coronavirus, again, they need to contact their provider and get appropriate testing and or treatment. Currently, the people that are getting tested, these persons under investigation, they either have a known exposure or some high-risk feature about their history, or they're somebody that fits the description that you just gave, and they've tested negative for other conditions like influenza or strep, things like that.
As far as our 911 emergency service people, are they being tuned in to, when people, number one, have people called in 911 yet because of their fear? And if indeed that does come to pass, can we equip those folks with, I mean, you call your physician, of course, you know, but, you know, not to call the police out or, you know, get an ambulance. Just.
People are calling our department because they feel that they have this. Our dispatchers have been given a sheet by the CDC to what exact questions that we have to ask them. And if they answer yes to those questions, then before they even send us or the fire department, you know, we want to get that made perfectly clear so we don't walk into a situation like that. But our dispatchers have been trained on what questions to ask and what measures to take depending on how the questions are answered. All right, answered.
Thank you. Yeah, no, that's very good.
Thank you, Rachel.
And this is kind of a question for Dr. Retchford again. Say I'm, you know, maybe a person who doesn't have a primary care physician, right? Who would be the normal person that you would probably want to call. For people who don't have primary care physicians in this community, where should they be directing those calls, if not to a primary care doctor?
Boy, I am remiss that I do not have the number off the top of my head right now. But there you go. You asked the wrong person. So we do have a 3649000. We do have a hotline within PHELPS Health for just the type of people that you described.
Okay.
So
That's the general medical group call center, and then they can direct you to the appropriate physician.
Perfect. Thank you. That's very helpful.
Okay.
Qualified health center out by the theaters would also be an option.
Okay.
And I got to add, Ashley just reminded me, the hotline that was in my presentation earlier, that can also be used by anyone.
Okay. Perfect. Thank you.
We have a full hour. I want to be respectful of the professionals' time because they're probably working very long days right now. So I want to thank you very much for what you do.
Thank you.
Thank you.
Why don't we give a few minutes maybe for some of you that might want to leave here before we move on to the boring stuff that's left. The idea was not to do that. Nudge her on the way past.
That's pretty darn good carrot cake.
This will beat any of ours. Everybody did a nice job. I think you feel bad because your wife went out and bought a bunch of toilet paper. That's what I think.
I do the shopping. I'm not much to it.
Moving on. Let's go back up to item 1, which is a public hearing, an ordinance rezoning 101 South Rutger. Tom?
All right, yes, this, I can see something. There we go. I think we're maybe on the right track. All right. So this is 101 South Rucker. They're at the corner of Rucker and Black Street. This building, you may recognize, it was formerly used as a church building. Someone has purchased the property and they are asking to rezone the property. Property is currently zoned C1, which is the neighborhood commercial district, requesting to zone it to the C2, which is the general retail district. Property is highlighted in the red. It is adjacent to the C2, which is the general retail district. It is also adjacent to, on the north side, properties that are zoned, this property is zoned C1, neighborhood commercial. It's also kind of catty corner from some highway commercial. But the general point is it's in the middle of a commercially zoned area and adjacent to property that's the same zoning that is being sought. The future land use plan does designate the property as being appropriate for community commercial. That would include the sought zoning district. It also puts it in the same categories as most of the property to the south and west, and would be across the street from neighborhood commercial areas that the future land use plan recommends. As I said, this property was previously used for a church building. The applicant would like to purchase the property, or has purchased the property, and they are seeking to put a restaurant, to remodel the building to be used as a restaurant. However, restaurants are allowed in the C1 neighborhood commercial district, but alcohol sales at a restaurant is not allowed in the C1 district. So the applicant is seeking to rezone it to the C2 district, pretty much just to allow for alcohol sales. The applicant is the same person who owned the Kyoto Japanese restaurant, which is on Bishop Street, and I believe is not operating right now. And they had alcohol sales at that restaurant. So just to summarize, it's consistent with the comprehensive plan and surrounding uses. The zoning, the property is not adjacent to residential zoned property that's being used for residential. There is a house kind of catty corner. That house is not zoned residential. The restaurant is permitted in both the C1 and the SOT C2 district, and the rezoning is necessary to allow for alcohol sales at the restaurant. The Planning and Zoning Commission heard the case last week and did recommend approval of this case with a vote of 8-0. Do you have any questions for me before you move to the public hearing?
Carolyn?
I have one question. I'm familiar with that area, and if it's going to be turned into a restaurant, there's going to be very limited parking there.
True. There is some existing parking on the north side of the building. Remember, it was used for a church before. The applicant has met with me. They are planning to have the property surveyed because the applicant believes that there is enough room between the building and the south property line to add a row of parking to give them just exactly what they need for the amount of tables that they wish to provide in the building.
Okay, let's officially open the public hearing. Is there anyone that owns property within 185 feet of this proposed zoning that would like to speak for the rezoning? Is there anyone that owns property within 185 feet that would like to speak against the proposed rezoning? Is there anyone that owns property outside of the 185 feet that would like to speak for the rezoning? And finally, is there anyone that owns property outside of the 185 feet that would like to speak against the proposed rezoning? If not, the public hearing is closed. Council, any questions for Tom?
No.
If not, the first reading, please.
An ordinance to approve the rezoning of 101 South Rucker Avenue from the C1 Neighborhood Commercial District to the C2 General Retail District.
Moving on to old business, we have one item, which is an ordinance authorizing me to enter into the State Transportation Revolving Fund Loan Program.
Yes, sir. This is a loan for $162,693. It's at a 1.2% rate, payable back over 5 years. It's basically our 5% match for the improvement project at the airport. The other 95% has been approved through Missouri Highway and Transportation Commission agreements. Work is scheduled to start this spring.
Steve, any chance that that interest rate will drop?
No. It is what it is now, once it's signed. Yeah.
Okay. Any questions for Steve?
1.2.
If not, final reading, please.
An ordinance authorizing the mayor of the city of Rolla, Missouri to execute on behalf of the city of Rolla, Missouri, certain state transportation assistance revolving fund loan agreement and promissory note between the city of Rolla, Missouri and Missouri Highways and Transportation Commission.
Is there a motion?
So moved.
Is there a second?
Second.
Motion made in second. Roll call vote.
Everly,
Yes.
Allen,
Yes.
Murphy,
Yes.
Boland,
Yes.
Schneider,
Yes.
Reuter,
Yes.
Crow.
No,
Did you say yes or no?
I said no.
No, okay. Schott,
Yes.
Roeder,
Yes.
9 ayes and 1 nay.
Ordinance is approved.
Carol, did you get John Mush?
Mush, I'm sorry.
Yes.
Moving on to new business. It's one item, it is ordinance authorizing me to enter into a hangar ground lease with Dr. Wilkerson.
Thank you, Mayor. We've been working on this for several months. You might recall that the city, inherited the building that has the ground lease at the airport from a total of about 40 years, expired. The city acquired a 4,800 square foot building. As part of that agreement, we've been renting it for the last couple of years for $200 a month. That is well below market value, but primarily because the building condition is in poor shape. Bad roof, bad T-hanger doors, deteriorating siding, just an unsightly building. It was going to take a lot of dollars from the city to invest in that. We discussed that, and rather than the city invest $40,000 to $50,000 in hopes that we can rent it for $500 plus or minus, council authorized us to go out and do a solicitation for either a leasing of the building or an acquisition of the building and then a ground lease back. We advertised that for about 3 weeks, and we received one proposal. Dr. Ron Wilkerson is a dentist in the St. James area. He happens to be a member at the Airport Advisory Board, familiar with the airport, has planes based there, did submit a proposal. We've had some conversations back and forth with City Council on a package that we thought made sense overall, and Dr. Wilkerson is in agreement with that. In fact, Dr. Wilkerson is here. Thank you, Ron, if you would stand, just so council sees the guy behind the agreement.
How you guys doing?
So we've been working this pretty diligently for the last month, I would say, or longer. And so what we have before you is an agreement that really transfers the building. It's got a $1,000 value assigned to that, but Dr. Wilkerson, for the agreement, within 3 years would invest $55,000, not less than $55,000, in a new roof, new doors, siding, other things that we'll have to evaluate as we get into it, whether the actual pedestrian doors or the windows in the facility need to be replaced or just upgraded. In addition, Dr. Wilkerson has plans to redo the interior of the facility. I don't know if it's going to be exactly like the Larry Roth facility, but very much a building I think would have a long-term ability to recover that investment. The lease is a 20-year term, the ground lease of $1,800 a year, and that runs for 20 years, and then there'd be the option for a renewal of a 10-year and a 5-year lease by mutual consent. So I think the city feels good about the arrangement. Dr. Wilkerson's been terrific to work with through this process. We're submitting this for a first reading tonight and a second reading at the next meeting. I got just a feedback, a vibe from Dr. Wilkerson. If there's anything we could do to expedite this, I think he's anxious to move along with the project. So you didn't formally request, I didn't ask you if you were interested in the first and final reading, but that might be something the council would consider doing. However, sometimes they prefer to do that over 2 different meetings. So happy to answer any questions, and Dr. Wilkerson, I'm sure, would be willing to do the same thing.
Any questions for either? If not, go ahead.
If I may, I'd like to add, the initial $55,000 investment, plans are to have substantial more, and as you mentioned with the Roth hangar that was adjacent to mine, or potentially mine coming up, it's something very similar and to the interior design of it, new surface floor coatings.
You did a very nice job.
Yeah, he did an excellent job with that. I'd like to mirror something kind of similar to that. I think if it needs to be done, it needs to be done right and not just half of it done while the interior goes downhill or anything of that nature.
If there's no questions, first reading, please.
An ordinance authorizing the mayor of the city of Rolla, Missouri to execute on behalf of the city of Rolla, Missouri, a hangar ground lease agreement between Dr. Ronald Wilkerson, doing business as Vichy Enterprises LLC, and the city of Rolla, Missouri.
Is there an interest on council's part to have a second reading tonight?
I don't believe it's an emergency. I think we kind of I understand he wants to get moving, but we've kind of loosened the rules on these second readings to the extent that it almost has no meaning anymore. And it's supposed to be under emergency circumstances.
It should be the exception, not the rule.
So,
any other council comments? If not, moving on to claims and/or fiscal transactions. First one is we did have a reading, right? Yeah. First one's a motion awarding a bid for e-citations. Chief?
As you all know, in December, our police department went what we call our live date with our new report management and computer-aided dispatching system. One of the benefits of having that system is the ability to do e-citations, which is basically our officers can type the citations on their mobile data terminals in their cars and then print the citations up. There's no longer going to be handwritten tickets in a ticket book. It's all done by computer. And one thing that this does that's very beneficial is right now, if an officer writes a hand ticket, it gets turned into the police department, and one of our clerks has to enter this all into the computer system. Then the ticket goes to our courts building, and it has to be re-entered into their system. Well, with the e-citations, when we put the tickets in the thing, it is automatically populated to both our police department and to the court system. So it saves a lot of labor. Makes it a lot easier. We have the capability of, on the back of your driver's license, every one of them, they have barcode scan. We can scan it on our MDT and it populates all the information into the ticket system, which makes it a lot quicker for our officers to be able to do their jobs and get back on the road. Now, we don't have any money for the budget for this, so what we're doing is we're going to use some of our drug seizure money that we have to pay for these.
Any questions? Matthew?
Chief, I just had a question about the seizure money. First of all, how much do we have in that account, and are there limitations on what we can spend on that?
We have about, right now, about $45,000 left in there, and that seizure money can only be used for equipment or training, which is why we're using it for this.
Okay. Thank you.
If there's no other questions, is there a motion to award the bid to CDW Government for the units?
So moved.
Motion made in second. All in favor, say aye.
Aye.
All opposed?
Thank you.
Next item is a motion awarding the bid for the University Drive pedestrian bridge. Darren?
So staff received bids for the pedestrian bridge over I-44 at the University Drive. We received 3 bids. Kelp Contracting out of Wildwood, Missouri was low bidder. You've got a copy of the bid summary attached. And staff is requesting a motion to award the bid to the low bidder, Kelp Contracting, and the first reading of ordinance authorizing the mayor to enter into an agreement with Kelp Contracting for $1,785,970.88. This would be pending concurrence and award from MoDOT. We're anticipating getting that on April 1st. Any questions?
So, Darren, this is TDD funded money.
Correct.
As I recall, I believe it was under budget significantly.
Not significantly. The budget was $2 million for construction. And
Okay, well, it's a couple $100,000 is real money. Do you want to explain, because there's a rebate from the feds or the state, I forget.
so, yeah, so MoDOT, we got agreement with MoDOT for them to reimburse us $500,000 toward this project.
Okay,
But that happens in '23, I believe.
okay. I knew there was another shoe there somewhere.
Just want to clarify what you guys just mentioned then. So the TDD budget is looking more like 1.28 million is what's going to come out of that?
So we budgeted 2.5 million, including design, and everything. And so we're a couple $100,000 under that.
$100,000 of that, but we're also going to get a $500,000 back at some point.
Right. So we'd always anticipated having, $2 million in TDD funding and $500,000 from MoDOT for this project, the 2.5, and,
So the TDD budget was net of the rebate from the state?
So the TDD will benefit from that, having a little bit extra, or can they not account for that because it comes in
No,
23?
the TDD is going to benefit with the extra.
Nice.
But again, it's one pot of money, and Kings Highway is the next one on the block here.
They're going to benefit with the extra 200 or also the extra 500?
No, the budget was the 2 million.
Gotcha.
Yeah,
Oh,
2
because of the
million.
5. Thank you.
Right.
All right.
Yeah.
I'm good.
Mayor, I just had a quick question. That $500,000 that's rebated back, is that, since it's coming back in 2003, is that beyond the time that we are required to spend it, or does it not matter because we've already spent it and we're getting the rebate?
So the grant rebate isn't a limitation of the bond spend down. So we have 5 years to spend the $32 million doing this project, and the other projects will expend that. It has no bearing on the $500,000 reimbursement, so that'll be available for TDD to pay down its debt, use it for another project, something along that line.
Okay.
You touched on a good issue, though. I mean, these timelines on all these projects are really driven by a specific date because the IRS has approved these as tax-free bonds. If we go over that time frame and the IRS changes it, those bondholders are not going to be happy campers that they're not tax-free bonds anymore. So everything is driven, I want to say March 2022? Everything,
what I remember.
everything on all these projects is driven backwards from that date. And that money has to be spent, so you can't.
Not obligated, spent.
Yeah, not obligated to spend. That's a significant difference.
So what projects, we have the bridge, we have the
Kings Highway.
What else?
The Kings Highway, the Highway 72, Turning Lane, University Drive, realignment.
And then if there's still
And if there's
funding.
money left.
Pine Street.
Yeah.
Revisioning of Pine Street from 63 down into probably 10th Street.
Okay,
It's
thank
a
you.
lot of things happening in a short period of time.
Right.
So is there a motion to award the bid to Kelpie Contract?
So moved.
Second.
Motion made in second.
Can I ask?
You have a question?
Oh, I'm
Can I
sorry.
ask a question? With the about $600,000 difference in the other two bids, are you pretty confident that the staff, the standard and the
Well, we
plans
are.
that
This is the
you-
same contractor that built the bridge at St. Robert, so they're, used to doing this type of work, and we had the consultant reach out to them, before tonight, just to make sure that, everything was good, and they said they went through their bid, they felt comfortable.
One company is quoting the bridge to all three of these.
That's correct.
Okay, thank you.
So there's a motion and second. All in favor, say aye.
Aye.
All opposed. May we have the first reading?
An ordinance authorizing the mayor of the city of Rolla, Missouri to execute on behalf of the city of Rolla, Missouri, a certain agreement between the city of Rolla, Missouri and Kelpie Contracting Incorporated for University Drive Pedestrian Bridge Project Number 359.
Moving on to item C, a motion awarding the bid of a 2020 crew cab. Darren?
So we opened bids on several different pickup truck models. Got a lot of good bids from locals and, out of town. Staff would recommend awarding the bid to low bidder in all cases. Items 1, 2, and 4 would be awarded to Taylor Dodge of Rolla, Missouri, and item number 3 would be awarded to Capital Dodge in Jefferson City, Missouri. Any questions?
We're going to vote on each one independently, but if you have questions, if we can just address them as all four.
I got one.
Yep.
What kind of money are you expecting to get through Gov Deals for the ones that we're going to be putting up for auction? Any idea?
So my guess would be, typically when we sell pickups, they'll bring anywhere from 5,000 to 10,000, depending on what shape they're in. Most of these are in pretty bad shape. I'd say it's going to be more in the 5,000 range.
If there's no other question, is there a motion to award on item 1, the 2020 crew cab to Taylor Dodge?
Second.
Motion made in second. All in favor, say aye.
Aye.
All opposed. Is there a motion to award item 2 to Taylor Dodge?
So moved.
Second.
Motion made in second. All in favor, say aye.
Aye.
All opposed. Item 3, is there a motion to award the bid to Capital Dodge of Jeff City?
So moved.
Second.
All in favor, say aye.
Aye.
All opposed. And finally, item 4, is there a motion to award the bid to Taylor Dodge of Rolla?
Motion.
Second.
All in favor, say aye.
Aye.
All opposed. Thank you. Item G, an ordinance authorizing me to execute a grant agreement with SEMA.
Last year, the city of Rolla was offered or was allowed to apply for a grant through SEMA for a one-time purchase of a storm siren. These are EMPG funds, which are dedicated funds through hazardous materials and such that are collected at the state level. This year, that grant application was also offered again for up to $30,000. The city, and these are grant dollars that are no match, 100% funded. The city was offered that grant to apply for that grant in February. We were made notified of the award last Wednesday, and that we would receive $23,465.74 of the request. They did cut a request for a radio that we made in that grant process, but we had outlined our priorities of the siren first and the radio second, and that if there were no additional funds, that's how we would like it to be prioritized. So they made that decision at the state level. We would ask that the council, this is through an ordinance, so we would ask that the council provide us with first and second reading for this as it does have a in-the-ground and working deadline of June 1. So that means we have to order this siren tomorrow.
So this is a emergency, right?
This is an emergency for an emergency siren.
I can agree with this one.
Plus, it's 100% matching grant, no matching funds. So we do have a deadline to get that ordered, and federal will not provide or will not hold a siren. They won't order it until this date. There are 10 sirens out there, so that they have awarded to the state, so we try to get ahead of the game and get it in. We were able to achieve that deadline last year. We had the same timeline and same timeline issues last year, and we were able to achieve the grant process and get it done.
Any questions for Chief?
I was going to say barely.
Barely. It was the last moments.
That's great.
I just want to say a quick comment, which is thanks for looking into these kind of things where there's obviously grants out there, and obviously being able to have that funding come from SEMA is useful for us. So thanks for looking into that.
Absolutely, and we have another one in the works that's 50-50. Not so great, but it's better than
That's right, zero.
than us funding it 100%. We have not heard on that one. This one will replace the siren at Ann and 10th Street at the RMU well house. That siren is about 25 years old, and well, a little more than that. And it does provide for the biggest area of outside activities, the Burr One Park. So that's why that siren is next.
If there's no other questions, can we have the first reading?
An ordinance authorizing the mayor of the city of Rolla, Missouri to execute on behalf of the city of Rolla, Missouri, a certain grant agreement between the city of Rolla, Missouri and the Missouri State Emergency Management Agency, and authorizing the purchase of an outdoor storm siren with federal signal.
I move that we suspend the rules and have second reading.
Second.
Motion made and second. All in favor, say aye.
Aye.
All opposed? Final reading,
Thank you.
please.
An ordinance authorizing the mayor of the city of Rolla, Missouri to execute on behalf of the city of Rolla, Missouri, a certain agreement between the city of Rolla, Missouri and the Missouri State Emergency Management Agency, and authorizing the purchase of an outdoor storm siren with federal signal.
Is there a motion?
So moved. Second.
Motion made and second. Roll call vote.
Schneider.
Yes.
Roder.
Yes.
Reuter.
Yes.
Bolin. Murphy.
Yes.
Schott.
Yes.
Crow.
Yes.
Mush.
Yes.
Allen.
Yes.
Eberly.
Yes.
10 ayes.
Moving on to mayor and or city council comments. There are 4 listed and 1 not listed. Steve, can you come up, so it's election season, it's spring sales coming, and not to Steve Flowers. I want to talk about signs. Signs in public right-of-ways, what happens if signs are in public right-of-ways? Can you give the citizens a little explanation on what's permissible and what's not?
Yes, nothing is allowed in the right-of-way. So if we do see a sign in the right-of-way, typically we'll go to the business or the house and we'll let them know that it's there. If there's no one around, we'll take it. We'll bring it to City Hall, we'll give them a few days, come and get it. Typically, we don't have a whole lot of problems with it if it's in residential areas, because if it is in a right-of-way, we tell them they've already given permission to give that sign. They'll usually move it back.
I know that the right-of-way adjacent to curbs and streets sort of ebbs and flows. So is there a general rule of thumb for somebody putting out an election sign?
Unfortunately, there's not, because that right-of-way could be anywhere.
Those ones on Oak Street are surprising.
Yes. Typically, I'd say 90% of the cases, if you keep it 10 foot back from the curb, you're probably going to be all right.
Okay, thank you. First item is a motion reappointing Jacob Roeder to the Bicycle Pedestrian Advisory Committee.
So moved.
Second.
Motion made and second. All in favor, say aye.
Aye.
All opposed? Good job. Stay involved. Next one is a motion reappointing Dick Elgin to the same advisory committee.
So moved. Second.
All in favor, say aye.
Aye.
All opposed? Third one is a reappointment of Jeremy Jamison to the Bicycle Pedestrian
So
Advisory
moved.
Committee.
Second.
Motion made and second. All in favor, say aye.
Aye.
All opposed? And finally, we have a vacancy, so we're looking to appoint Jonathan Garrett to the Bicycle Pedestrian Advisory Committee, and there's a short bio in your packet.
So moved.
Second.
Motion made and second. All in favor, say aye.
Aye.
All opposed? Thank you. Any other council comments before we move on to citizen comments? David?
I just had a couple quick things. So I know that our public safety folks are putting themselves at a little bit bigger risk with some of the coronavirus stuff. They're in the high-risk category to start with, and we thank them for all they're doing. I just want to bring attention to, I know the use tax is going to take a while to get going, and we had some discussion about a stopgap measure in between to just show the public safety that we might be getting something started there. And I just was curious if that's something that we're going to start talking about, as well as I know there were some retirements involved, so I'm just curious to see where that might be at.
We have a plan. John and I met Thursday again on it. I would say a couple of more weeks. I would say that, I'd say a couple of things for it. I think there's really 4 decisions that administration and council is going to have to work through, not all of them at once. The first one is, can something be done now in that period when we do not have any of the revenue dollars come in? That's obviously the first one. And I would tell you, my gut tells me that there's probably nothing either tangible or symbolic that could be done in that short period of time. The second one is, what can be done starting on June 1st when those revenues do start to come in? That may be in that category of something that could be done that's going to be more symbolic than it is going to be tangible. The third decision will be part of the budget process, and the critical driver there is going to be, what estimates do we want to use as far as revenues coming in the fiscal 2021 budget. And then the final threshold will be the following budget cycle, when we have a full year's worth of revenue that's a known number. So the biggest issue here is how much money's going to come in, and that number will run from 200,000 to 500,000 or something like that. It's also worth noting that general fund tax receipts year to date, the budget, I believe, is based on 1.5%. 1.5
I think
or
it's
2.
2.
Might be 2.
Yeah.
Year to date, it's running just a smidgen over 1%. Now, that 1% means we're not getting in what we thought we would get in. It's not a substantial number, but it is a potential sign of what retail sales are or are not. So I suspect in a couple of weeks, we'll come back to the fiscal advisory group first, let them know what we're finding, and then come back to City Hall. So we would expect addressing this in four periods. John, do you want to disagree or add to that?
No, the only thing I would add is that we're actually up about 3.5% year-to-date, but by the time we net out
Net
the
of the
TIF
TD.
redistribution, it's just a 1%.
I just had a quick follow-up, which was, does sound, I completely agree, we can't really address much of this till we start seeing what that could be, and I know that we're close to the fall or whatever to know much more, but I know there was some talk of certain departments with some retirements. Is that anything we can still at least talk with the fiscal board about, if that could be
We
an option?
will. I'll tell you what my gut tells me, that is not going to be our recommendation, and there's various reasons for that, but I don't think we want to get into it here and now because there are specific people that would entail, but generally that's a Band-Aid.
And I had one other quick, just question / comment. I know this is all fluid with everything that's going on with the virus and everything, but is there any contingency or any concern at this point about the municipal election coming up? Is that something we would just obviously take based on the situation as it comes? I don't know how that.
Yeah, it's just whether to pull it off, you mean, whether or not there's going to be an issue with elections. And I posed that question to Larry. They're going to have that conversation with Pam Grow. That'll really come from the state. The state would have to make some kind of decision that they're going to somehow delay an election outside of that period. I have a hard time imagining that, but it's a legitimate issue for the county election clerk, and I just have not heard whether they are planning to do anything different.
Be made on a state as opposed to a county level.
Yeah, I'm sure that she'll take her guidance from the state. I doubt that a local election authority would affect the scheduling of an election that the state of Missouri authorizes.
Along those same lines, as Steve Hargis brought up today, is the pending census. So with classes restricted at the university and a lot of kids leaving, remember that census is based on where you put your head that night. So the way that thing will fall, we could end up undercounting our normal population, which will be detrimental to us. So frankly, hopefully speaking, the government will push that census back.
I was say, if I could add one thing to that too. I happened to be at the library the other day when a spokesperson for the League of Women Voters came to speak about some issues with the census in Rolla, and what she mentioned is that Rolla is historically undercounted compared to many other municipalities. I think it has to do with the student population, maybe some immigrant population, I'm not sure. But obviously anything we can do within our communities to encourage every person that's in every way here and living here to fill that out and take it seriously. Like the mayor said before, it matters for us, it matters for county, it matters for state, it matters for federal. And so anything we're undercounted is hurting all of us. So
The university helps us with that, and I believe this is the first year you can respond online, isn't it?
Yeah, online and by phone. And Tom's going to do at the next council meeting an update of just the whole process. We've had a complete count committee working for the last maybe 3 months or so. I'm certainly hearing and seeing more of it out there. But you're right, we're trying to see whether or not there's been any impact as a result of the viruses too, is whether that will impact it. Right now, we haven't gotten any vibe that that's the case, but we'll do an update at the next council meeting.
So let me just say, I did mine today. I did my census online today. It took me probably 7.5 minutes. And that was, I had to think about a couple of things.
It could take you 5.
It might, it's not very complicated, and you don't have to have anything special to answer the questions. It's very simple, takes you right through it, and boom, you're done.
So I just learned something. I thought it was on a specific day, like an election. So you can do this anytime?
Anytime. I got a flyer in the mail that had a identifier number for me. When you go onto the website, it says, start your questionnaire. You put in that little number and it pops up, and basically it's your name, how many people were living, and you answer a few questions about each individual that's in your household, and that's pretty much it. I mean, you put in your ethnicity and your sex or gender, and that's about it. I mean, it's not very complicated.
So Tom, where does that mailing list come from?
The Census Bureau would have worked with the city last year. Basically, they get a list of every address in town, and the city's Bureau of Public Works GIS folks work with them on that. And I'll just add the April 1st thing, that it's sort of a celebratory date anymore. It's a lot more complicated than just where you rest your head on April 1st. That generally it's where you spend your most of your time during the year, and you don't have to wait until April 1st to fill it out, as Ms. Eberly alluded to, because people are starting to get their postcards in the mail now, and will be over the next week or week and a half. And so somebody like a student, since they spend 9 months out of the year, they should, no matter where they are on April 1st, still report them as being a resident here in Rolla. So the only people that it literally applies to for April 1st is somebody who splits their time pretty much evenly between 2 or more locations, and then they would literally put down where they're at on April 1st.
Yeah, the last question basically says, of all of the people in your household, do any of them spend time at another residence, so they don't double count people? And, I didn't say yes, so I'm not sure what it asks you as a follow-up, but I'm assuming it would say, for that person, what's the address that they spend their other part of their time at?
That sort of leads into what I think is probably the only somewhat controversial question they ask you. They ask you for your phone number. And the reason why is because if they have questions about your response, they can call you up and try to clear it up. So like on that question of, is there somewhere else where you might have been, they may need to call you up and, well, how long were you there? Or if you're reported somewhere else and you're also reported here, well, why are you reported here and there? And so try to clear it up.
Does the questionnaire force you to answer each question, or you can skip over something you don't like?
I don't know for sure.
It did say that once you start it, you have to finish it. If you quit in the middle because you had a phone call or something and you go out of it, then you have to start over.
Yeah.
So you can't come back to it. You have to do it all at once. But again, 5-10 minutes and you're done.
As I recall, they really want you to answer every question, and they'll probably, if you gave their phone number, they'll probably call you up if you don't answer a question. But I'm pretty sure you can forward through, but they may pop up with, are you sure? Are you really sure?
Right.
Types of boxes and things like that. But
Rachel?
Yeah, this is maybe just a random thing, because I tried calling the hotline and I just got busy, so I disconnected before I got someone. Because I actually got 2 different ones to my house, one of which addressed to an apartment at my house. And I guess I just throw that in the trash, or
I guess so.
double count?
Hey, we need representation. Fill both of them.
I got 5 people living in the unnumbered apartment.
Do you have an apartment in your house?
No.
Okay.
I think it may have at one time had an apartment, but in the distant past. But time out of mind.
Ann?
The instructions that I read too is they will attempt 3 or 4 mailings before they send someone to that address to try and get information.
that's right. They'll send the postcard a few times. They're really pushing for people to go online and fill out online. If you prefer, you can call. That still takes some manpower to man the phones and whatnot, but they're really prefer for people to just do it online. Go ahead and do it the first time around. They'll send us a few postcards and reminders and whatnot, and then they'll eventually follow up with the old-fashioned paper form that you can fill out and mail back. And then if you still don't respond, they will have to send somebody to your door. So what I say is, just go ahead and do it.
Right.
It saves everybody a lot of time and effort. Just go ahead and do it.
So you're going to present at the next council meeting?
Yes. And I've already said 90% of what I was going to say.
It's one of those subjects you got to keep saying.
That's right.
Hammer it.
Any other council comments? Citizen communication. Is there anyone that would like to speak to city council? Comments for the good of the order? If not, we have 3 specific topics dealing with real estate, proposals, and personnel for closed session. Is there a motion to go into closed session?
Second.
Motion made in second. Roll call vote.
Schott,
Yes.
Mush,
Yes.
Boland,
Yes.
Schneider,
Yes.
Reuter,
Yes.
Allen,
Yes.
Murphy,
Yes.
Crow,
Yes.
Eberly,
Yes.
Roeder,
Yes.
10-8.
Well, we're moving fast enough.